Hi, today we're going to talk about dry eye and dry eye treatment. The first part we'll talk about is basic anatomy and what dry eye is. So when I explain to patients dry eye, the biggest words, the most common words that I use is inflammation. The core of dry eye is inflammation. When we talk about dry eye, it's not just a simple, yes, my eyes are stinging. It's a multifactorial disease, which has a very, very long-winded definition. Symptoms of dry eye that I present with patients is either going to be stinging, is going to be irritation, blurry vision, especially fluctuating vision too, especially if looking at screens on their tablets, on their phones, even watering, and also watering can be, it's kind of ironic if you say watering, but no, I've come with dry eyes. Yes, watering is a specific type of dry eye as well. When we take a look at the three different types of layers in our tear film, the most anterior surface is oil. Then we have water, a thick layer of water, and a thin layer of mucus, which is a base layer. I always love analogies, so when we talk about the three different layers of our tears, I use an example of a house. The foundation is mucus, the walls are water, and the roof is oil. Now the purpose of mucus is for something sticky. Our cells of our eye is very, very smooth, and water is very smooth, so we need something for the water to adhere onto. The second layer, water, is the thickest layer. It has all your oxygen, waste, nutrients, and antibodies. The most anterior surface is oil, and that prevents evaporation of our tear film. Same thing when we go back to the house analogy, without the foundation of the house, everything moves around. Without the walls, which is the water, everything collapses, and without the roof, which is the oil, everything disappears. Now, different parts of the eye produce different parts of our tear film. The most common type of dry eye is oil layer deficient dry eye, and our eyelid glands, called meibomian glands, are the ones who produce the oil. When I talk to patients about this, there's 25 glands at our lower lid and about 35 glands at our upper lid. This evaporation, this is what causes watering. This is what kind of makes sense where there's excess watering for the dryness.